Hello, I'm Dr. Barry. I'm a board-certified plastic surgeon here with Wake Plastic Surgery. Today we're going to be talking about some frequently asked questions related to some common facial rejuvenation procedures. We'll be talking about face and neck lifts, brow lifts, and upper and lower eyelid lifts or blepharoplasties. So a facelift is a surgical procedure that aims to lift and reposition the deeper tissues of the face to correct some of the changes that we see with aging. And so it aims to correct jowling, tissue laxity, and some of the deeper creases that we see in the cheeks and beside the chin. Also aims to improve the volume of the face to correct some of the changes that we see with volume loss or fat atrophy. Many people think of this as something that dramatically changes someone's appearance, but the goal is really not to change someone's appearance, but to really refresh their look, have them look like a more youthful version of themselves. And so really, I think it's good to think of this more of a reset rather than a makeover. So a neck lift is a component of a face and neck lift, which aims to recontour the area under the chin and jawline. And this may include removing excess fatty tissue, tightening the muscle that may have separated in the midline, removing excess skin. But it really is just a component of a face and neck lift. Many people think of this in isolation, but in fact, your face and neck both age together. And so even though some people may have more visible signs of aging in one or the other, usually a combination of a face and a neck lift to similar or even different degrees is necessary to get a harmonious result. And so while we can address them separately, it is important to keep that in mind. So you can get a facelift without a neck lift, but as I mentioned, the face and the neck do tend to age together. And even though some people may notice more advanced signs of aging in one versus the other, usually you get a more harmonious result when both are addressed. If people notice mild jowling or sagging of the face without significant changes in their neck, then absolutely a facelift in isolation can achieve their desired goals. And one of the benefits of doing one over the other or doing even less of a surgery is that you have a shorter recovery, a shorter scar, and then generally you're able to have your final results sooner. So a mini facelift is a less invasive version of a traditional facelift. It addresses some of the earlier signs of facial aging, and that may be in the face or even in the neck. And so the benefit there is that we're able to have a faster recovery with shorter, less visible incisions. And so people are able to address earlier signs of facial aging sooner without anyone knowing they had surgery done. So yes, you can get a facelift after you've had various forms of non-surgical facial rejuvenation. Fillers, neurotoxins, PDO threads are some things that people often get before seeking surgical consultation. That absolutely is safe to perform a facelift in that setting, but it is important to let your surgeon know if you've had these, especially recent filler, which we may choose to dissolve prior to surgery. Absolutely. So, this is a common concern that patients often have, whether a facelift will change their appearance or have them look unnatural. The goal of a modern facelift is to lift the deeper tissues of the face, really not to change how someone looks, but to give them a more refreshed, youthful appearance that still looks like them. This is different from how people did facelifts historically, where they pulled the skin as tight as they could and created this windswept look, which really was not a very aesthetic appearance. But our goal is to give you a natural result that really turns back the clock, has you looking like you, but a more fresh, vibrant, and youthful you. So there is no age cutoff for facelifts. There are people in their 40s who benefit from a mini facelift to really tackle some of the early signs of facial aging. And there are people that are well into their 60s and 70s who show more significant signs of facial aging that may benefit from a full face and neck lift. I think if you're overall healthy and have reasonable goals, then you absolutely are a candidate. And based on your anatomy and goals, we will devise a plan that can essentially help you achieve that. So this is one of the major advances with modern facelift techniques. We've recognized that not only do you have sagging of the tissues of the face, but you also have volume loss from fat atrophy. And so what fat grafting accomplishes is removing fat from somewhere else on your body, usually your abdomen or inner thighs, and replacing some of that volume loss in your face, whether it's your cheeks, your temples, under your eyes, some of your folds to help soften those folds, really to restore some of the volume that's been lost and get you a more harmonious result. So medical grade skincare is absolutely important. We think of facial aging as affecting skin quality. We talked about skin laxity, and we talked about loss of volume. And so during surgery, we can improve your skin laxity, we can improve your volume through fat grafting, but your skin quality is something that skin resurfacing and medical grade skincare really can have a dramatic impact on. And so I think to have an overall rejuvenated appearance, to really turn back the clock, addressing skin is important. And medical grade skincare, it is a pivotal role there. So generally, I'd say recovery is easier than people expect. Most people are doing great by 2 weeks and feel comfortable going back into social settings. During those 2 weeks, people have swelling, some bruising, and some sensations of tightness, but really not much pain. The swelling and bruising usually significantly improve over the first several days, that by 2 weeks, people feel comfortable going back into social settings. And by 4 to 6 weeks, most people can't tell that they've had surgery and they have an amazing result as early as that. So when you think of the timeline for results, you'll see an immediate change after surgery. As swelling and bruising improve, you'll see a dramatic change by 2 weeks that you're comfortable going into social settings. But swelling will continue to improve. And so usually between 3 and 6 months, you are going to see a very close idea of what your final result will look like. But I'd say by 4 weeks, people are extremely happy with their result, extremely comfortable in social settings, but it keeps getting better from there.